My name is Shawn Roberts. I did my training at Hennepin County Medical Center in Minneapolis. I believe 3 out of the 4 of us trained there, so we've got a nice little group that came up here. But I'm actually from this area. Grew up and graduated from Crosby High School, went away to do my schooling, and then came back to start a practice. Endoscopy is essentially taking a long camera on a tube and passing it. In this case, we're looking at passing it into the upper esophagus, down through and into the stomach, and the first part of the small intestine that's called the duodenum. So oftentimes this is abbreviated EGD, and that stands for esophagogastroduodenoscopy. Technically, anybody who's had any kind of changes in terms of their swallowing, it would be a common procedure. Oftentimes in that setting, it might be something that a patient would complain of when they see their primary care physician, and their primary care doctor would set that up. Obviously, there's more emergency-like situations where if you're vomiting blood or something along those lines, the most common thing that we see is a change in reflux-like symptoms for heartburn. It is probably one of the biggest and most important tools that we use to evaluate the esophagus and the stomach and the anatomy of the area, also to look for potential complications related to reflux disease. Well, the biggest thing with this procedure is you get to take a nice little nap while we do it. So the toughest part of your day is coming in and getting an IV. Once that IV goes in place, somebody from anesthesia will come by and chat with you about their portion. When you're asleep, we'll put a little bite block in the mouth, and what that does is it protects the teeth, and it also prevents you from accidentally biting the scope while you're asleep. You're not under general anesthesia. With general anesthesia, you have a tube down your throat, and we're breathing for you. You're just very comfortable, very sedated. We use a very short-acting medication, which is nice because it starts working right away, but it wears off quickly, so you can have a nice normal day after we're done. The procedure itself, depending on what we do, if we end up finding anything or having to take biopsies, might last 5 or 10 minutes only. But to patient experience, it'll feel like it took about 10 seconds. So some of the things, we will have some results right away that day. So obviously, if we see something, if we see esophagitis or inflammation, we'll be able to give you a little bit of a report of that. Some of the things we're looking for might be precancerous changes. Precancerous changes occur in people that have had reflux for a long period of time. So we may need to take biopsies, and those biopsies can take a couple days before that information will come back. The other thing that we're oftentimes doing is assessing for the possibility of bacteria that might be in the stomach and can contribute to ulcers. And then finally, we're oftentimes doing reflux testing, where we'll attach a little tiny capsule to the bottom of the esophagus. That little capsule will measure any changes in pH over the course of the next couple of days. That information generally gets sent wirelessly to a computer. We can download that information and then generate a report that tells us all about your reflux. That information, we would usually have some kind of follow-up appointment to see the results of that and discuss it with you, and then talk about management strategies. This is an incredibly common procedure. We see this all the time. There's 4 surgeons here. We probably do, I would guess we'd have to do in the thousands per year. So if you break it down, monthly, probably several hundred a month. It's easy. It's a very important part, but thankfully it's one of the easier things to do here just because of the sedation process.